Everyone. After our detour off into narcissism for a little while there, I want to bring us back to our series on some of the mental health diagnoses that are commonly seen in the population. And today I want to start touching on bipolar disorder. So bipolar disorder has two types, bipolar 1 disorder and bipolar 2 disorder. Today we're going to talk about bipolar 1 disorder, which is a little bit different than the bipolar 2. Now, when we talk about bipolar, we often think about it in terms of this rapidly shifting mood where you're sad one minute and you're happy the next. And often that's how it's shown in TV shows, it's shown on movies, those sorts of things. But the reality is a shift during a bipolar episode is a gradual change that lasts for a period of time. And it's generally, depending on the type of bipolar disorder, at least 3 days before there's any sort of a change in that level of mood. So it's important to remember that what we colloquially call bipolar is actually not. So if your mood switches back and forth really rapidly, or you feel like you're kind of up, down, all over the map all the time, I suppose the good news is that it's probably not going to be a bipolar disorder. It's probably something else. So when we're diagnosing bipolar 1 disorder, primarily what we're diagnosing is the presence of a manic episode. So there could also be a depressive episode, but it's not necessary for the diagnosis of bipolar 1. I'm going to talk a little more about the depressive episode later in the next video when we talk about bipolar 2. So for today, for bipolar 1, I want to focus on the idea of mania and what that actually is. So a person who becomes manic, they'll have an inflated self-esteem or this grandiosity that's very uncharacteristic for them. So suddenly they'll think that, they can run for president of the United States, and they might start like passing out handbills, and, they live in Canada and they're not a politician. But all of a sudden they've hit this inflated self-esteem or inflated grandiosity, and they think they can do it, and you can't convince them otherwise. There's a decrease in the need for sleep. So people who are in a manic episode may sleep like 2-3 hours a night. Some people don't sleep for days at a time because of the shift in body chemistry. When you're with someone who is in a mania or having a manic episode, the individual will talk a lot more than usual, and it'll be really pressured. So it'll be like their words can't come out fast enough, and their words can't keep up with how fast their thoughts are running. So they'll talk kind of like an auctioneer almost, some people. They're also highly distractible. So their attention is drawn to every stimulus or all kinds of stimuli, whether it's important or unimportant, it doesn't really matter. They'll have what we call a flight of ideas. And what that looks like is one idea that they have may lead them to another, to another, to another, but you may not be able to follow how they got from one topic to the next. So they may start talking about Easter dinner, and then all of a sudden they might start talking about, where they raise turkeys and how turkeys grow in a barn. And, did you know such and such a country raises most of the turkeys? And then they'll be off to tourism in such and such a country and how they want to go there. And so it's very hard to carry a coherent conversation. There's also an increase in either goal-directed activity or what we call psychomotor agitation, which is non-goal-directed activity. So they might suddenly, when it comes to goal-directed activity, really throw themselves into one activity. So for example, they may decide that they're going to pass this one course that they have in like a week. And so they're going to do all their coursework in a week, and they're not going to sleep, and they're not going to eat, and they're just going to focus on getting it done. So it's goal directed, but it's goal directed to a very unhealthy level. When you have psychomotor agitation or kind of more purposeless activity, it's basically just the need to move, but the activity doesn't really do anything. So, for example, someone may sit down and write the alphabet over and over and over and over and over again, or they may, draw stick figures on every wall of their bedroom, and it's an activity, but it's kind of purposeless. Or it can be as simple as, for some individuals that I've worked with in the past, climbing on top of furniture or standing on a car, or it's just engaging in some sort of activity they become very focused on completing, but that has really no purpose behind it. They may also have an excessive involvement in really risky activities. So, for example, one of the most common ones actually is someone with this diagnosis who's in a mania may suddenly spend all their money on something ridiculous. So they may decide that they're going to sell, bags of potato chips on the street corner. And so they're going to sign into Amazon and buy like $6,000 worth of potato chips. And then they're going to stand out on the street corner and try and sell it to the cars driving by. And, they can't afford to do that. It's basically all the money they have, but they're not going to care about the consequences because it's an excessive involvement in the activity. It can also be, someone who is committing or engaging in a lot of sexual indiscretion. So really reckless sex or sex in really inappropriate places. If you're a person who has some type of involvement in a business, you can start making really foolish business decisions that, the risk is not worth it, or the risk is going to result in massive losses that are predictable. And so this one aspect of mania can cause a lot of difficulty for people. When we're looking at diagnosing as a clinician, we want to see the symptoms of the mania present for about 1 week or more. So that right there will tell you, obviously, this isn't the rapidly shifting occurrence that most people expect or believe that it is. So oftentimes when people hit a manic phase, depending on the intensity of it, they may end up in hospital for the duration of that phase, just to keep them safe and to keep them from making any decisions with long-term negative consequences. Now, the other thing to keep in mind is, as we were talking in other videos, having a shift in mood is normal. So throughout, say, a month or a week or even a day, most of us can have our mood change just slightly. We might be a little happier one day, a little less happy the next. So that is not obviously going to qualify a person for a diagnosis of any mental health challenge, any mental health disorder. But when it hits the extreme, like it does with bipolar 1, where you're going to be excessively manic for at least a week, and then you're going to either drop back to your regular mood or down into a massive or a major depression, that is going to cause issues in your life. It's going to make participating in the world really difficult. And that's when we will come in with a diagnosis and look at the idea of medication to help regulate moods. And the other thing that's really important to note is when we look at making this type of a diagnosis, that it can't apply to someone who has used drugs. So, for example, using a stimulant can replicate what it is like to have almost a manic episode, but we would never diagnose mania because it was caused by the substance that the individual ingested. Now, treating bipolar 1 or bipolar 2, there's few medication options, but the primary direction people take is medication because of how greatly affected a person's life can be and the potential for them to really destroy a lot of what they've worked and built over the years. It is something that is possible to treat psychologically through therapy, but most of the time this is done as an adjunct to a medication. It's not done on its own. I have encountered rare cases where people have managed to learn skills and techniques to manage bipolar without their medication, but those occurrences are very few and far between. And most of the time, it's a bipolar 2 diagnosis as opposed to bipolar 1. So hopefully you found that helpful. Next week, I will release a video on bipolar 2, and we'll get a little more into hypomania and if there's a depressive episode, what that looks like.